Hey guys, it's Bear. It's Sunday, June 14th, 2015. I had my top surgery on June 9th, so today is 5 days post-op. And I just wanted to touch base and kind of sum up the experience so far. I did a video the day after talking about kind of, how it went at the hospital and everything. But as far as, the initial recovery, I wanted to go ahead and kind of sum that up. So, like I said, it's day 5. The first few days home, like Tuesday night, Wednesday, and Thursday, I was basically just sort of in a haze, it was basically just, sleep, wake up, eat enough to take the pain meds, and then, within an hour after taking that, just sort of pass out again. And that was perfectly fine. And then Thursday night, Friday morning, around, probably around 3 a.m., 4 a.m., I just started getting horribly nauseous, and managed to sort of sit up and just drink some ginger ale, and ride out the nausea. And then Friday was fine. I went back to bed, got up, and did my usual routine, on Friday, and was fine. And then yesterday, Saturday, I just was horribly, horribly nauseous the whole day. And I got up around, I don't know, 6 or 7, I guess, and had breakfast. Took the Norco, and just within an hour just started feeling really, really awful, bad, nauseous headache, where the nausea is not really in your stomach, but it's more in your head, and you just feel woozy. Laid back down, napped, got up and felt a little bit better, ate some lunch, took some more pain meds, napped, got up, and was just horribly nauseous. And I had called on Friday and talked to the nurse. Now, let me backtrack. Initially, when she told me she was going to put me on Norco, I looked that up, and that's basically Vicodin. And I've had Vicodin twice before, and each time that I've been on it, it's made me nauseous and it's made me vomit. And so I protested when she told me that. I said, I really have had a bad experience with Vicodin and painkillers that are similar to it. They always have made me vomit. And the nurse just sort of said, well, look, it's the best painkiller for the amount of pain you're going to be in. It's a major surgery. So we'll make sure, we give you some anti-nausea medicine if it comes up. And just be sure to eat something with it and you should be fine. And that's what they've always told me, and I've always vomited. So Friday, knowing that I was going into the weekend and knowing I wasn't going to be able to get a hold of this nurse, because it's a Monday through Friday doctor's office, I called and said, yeah, I was up in the middle of the night with horrible nausea, and she called in this anti-nausea medication. So Saturday, when I was really feeling bad, I took one early in the day, and I took one about 6 hours later, which would have been around 8 o'clock at night, and then I finally just went and threw up at around 9 o'clock last night. So yeah, I'm gonna see her tomorrow to get the drains taken out, and have the dressing either changed or removed completely, and I'll tell her at that point that, I need something different and that this medication isn't working for me. In the meantime, yesterday around 3 o'clock was the last time I actually took that, and I've just been taking copious amounts of Tylenol to deal with the pain. The pain at this point is not that bad as far as the actual incisions go. The incisions are kind of under here, but there's these drains sewn in under my armpits, and the drains are under my skin. I can actually feel them, and they're incredibly, incredibly uncomfortable. And where they're coming out under the armpit is probably the worst area of pain. They're obviously there for a reason. There's still a lot of fluid needing to come out, and that's, normal for this kind of surgery. But hopefully tomorrow they'll decide to take them out, because that's causing me the most amount of discomfort and pain. So yeah, so tomorrow I'll have that appointment. They'll hopefully take the drains out, and at that time I'll ask them to put me on some kind of pain medication that doesn't make me nauseous, and hopefully this time they'll listen. For whatever reason, the last 2 times I've been put on Vicodin, I have said, Vicodin makes me vomit, and the doctor or the nurse or whoever I'm dealing with just completely disregards that complaint. And every time, lo and behold, it's made me vomit. So I don't know why they just don't seem to believe me. I'm not out there trying to get better pain meds. I'm just trying to not have to go through the experience of vomiting while I'm already in pain. And let me tell you, last night, when I finally went and vomited, it was really a horrible experience vomiting while you have a chest full of stitches. Your torso, gets all rigid when you actually throw up, and everything that's there sewn together is pulling. And so not only are you vomiting, which is horrible, but you're vomiting, and you're pulling your sutures. So, that's great. But anyway, whatever. Moving on. Today I feel a lot better. I don't feel that foggy headache, gross nausea anymore. And I'm just trying to take it easy as far as eating stuff that's pretty mild, and that's been okay. So yeah, I'll let you guys know how it goes tomorrow. Put some pictures up of the results if I end up having the dressing completely taken off. And thanks again for everybody who's been calling, texting, and messaging. And see you later.